Infertility isn't just a hiccup on the route to parenthood, it's a widespread challenge affecting millions worldwide. It's like trying to solve a puzzle where pieces just won't fit, leaving hearts longing and dreams on hold. Precisely, infertility is a condition where you can't get pregnant after 1 year of trying to conceive due to various factors. Imagine this amidst the whispers of love and the flutter of hope, the journey to having a baby begins. But sometimes, despite all the efforts, something just doesn't click. For younger couples, it might take a year of trying before they seek help, while older ones may feel impatient after just 6 months. But here's the thing, there's hope twinkling on the horizon. A whole toolbox of treatments are there to help turn dreams into reality. From big cities to quiet towns, people everywhere are coming together, sharing stories and supporting each other through this journey. In Malaysia, where life buzzes with energy, the story is the same. The drop in fertility rates echoes a global trend, but within this shared journey lies a tapestry of unique tales of strength, courage, and the unbreakable spirit of hope. So, to anyone facing this challenge, know this, you're not alone. Together, we're painting a picture of perseverance and possibility where every heartache is a step closer to a brighter tomorrow. Infertility can be caused by many things like health issues in you or your partner, or a combination of factors that make getting pregnant difficult. But of course, there is good news. There are lots of safe and effective treatments that can help increase your chances of having a baby. So, don't lose hope yet, because when there is hope, there's always a way. While for women, ovulation disorders disrupt the release of eggs from the ovaries essential for conception. Conditions like polycystic ovary syndrome cause hormonal imbalances, while elevated prolactin levels and thyroid hormone irregularities also affect ovulation. Lifestyle factors such as excessive exercise, eating disorders, and tumors can compound these challenges, highlighting the delicate balance required for reproductive health. Fallopian tube damage or blockage, often due to salpingitis, occurs when the tubes become swollen from pelvic inflammatory disease, an infection of the female reproductive organs. This swelling hinders the passage of eggs from the ovaries to the uterus, which impacts fertility. Endometriosis occurs when tissue similar to the inner lining of the uterus grows outside of it. This misplaced tissue can affect the function of the ovaries, uterus, and fallopian tubes, potentially causing fertility issues. Low sperm count or oligospermia can be influenced by a fascinating array of factors. Undescended testicles, genetic conditions like Klinefelter syndrome which alter the blueprint of life, hormonal imbalances such as hypogonadism that result in insufficient testosterone, and also chronic illnesses like diabetes which damage nerves and muscles all contribute to reduced sperm production. Secondly, problems with sperm reaching the female reproductive tract can also cause infertility. These issues can be due to sexual conditions such as premature ejaculation, certain genetic diseases such as cystic fibrosis, physical problems such as blockage in the testicle, or damage or an injury to the reproductive organs. The environment plays its part too, with toxins, pesticides, and industrial chemicals acting as unseen enemies, while excessive heat from hot tubs or saunas raises counter temperatures, stifling sperm production. Lifestyle choices such as smoking, drug, and alcohol use add another layer, which all conspire to lower sperm counts.
IVF is a fertility treatment where an egg and sperm are combined outside the body in a laboratory dish. Once fertilized, the embryo is then transferred to the uterus. This method is used to help individuals or couples with infertility issues conceive a child. IVF has been a groundbreaking advancement in reproductive medicine, offering hope to millions worldwide who struggle with infertility. The average cost of an IVF cycle in the United States is $15,000, which is 71,515 ringgit. This doesn't include the cost of medication, which can cost approximately $5,000, which is 23,850 per cycle. It is difficult to provide an exact cost because it depends on a number of factors, including your insurance coverage, the treatment center itself, and your health history and treatment plan. To enhance the effectiveness of this treatment, these are some medication used. First, follicle-stimulating hormone. This hormone works to stimulate ovaries to produce eggs. Second, leuprolide acid is a type of gonadotropin-releasing hormone which initiates a response that's given as an injection. Third, human chorionic gonadotrophin. This hormone triggers the final maturation of the eggs and their release from the ovaries. IVF, while offering hope for many, comes with some risks. One risk is that the ovaries may swell due to the medications used. This can be uncomfortable and, in rare cases, even dangerous. Additionally, IVF increases the chance of having twins or more, which can lead to complications during pregnancy and childbirth. There's also a risk of the fertilized egg implanting in the wrong place, like the fallopian tube, causing an ectopic pregnancy. Miscarriage can still happen with IVF, just like in natural pregnancies. While babies born from IVF may have a slightly higher risk of certain health problems, it's not very common. IVF can also be emotionally and financially stressful. Finally, though rare, IVF procedures can sometimes lead to infection, bleeding, or damage to nearby organs. The success rate of in vitro fertilization can vary depending on several factors, including the age of the woman, the cause of infertility, the quality of the embryos, and the expertise of the fertility clinic. Generally, younger women tend to have higher success rates with IVF. According to the Centers for Disease Control and Prevention in the United States, the average success rate per IVF cycle for women under 35 is around 40%, but this rate decreases with age. It's important to consult with a fertility specialist to get personalized information about success rates based on individual circumstances.
وزكريا إذ نادى ربه رب لا تذرني فردا وأنت خير الوارثين فاستجبنا له ووهبنا له يحيى وأصلحنا له زوجه إنهم كانوا يسارعون في الخيرات ويدعوننا رغبا ورهبا وكانوا لنا خاشعين.
Next, how can we increase fertility? First, we must eat foods rich in antioxidants. Antioxidants may help the active free radical in our body, which can damage both sperm and egg cells. For example, we can consume vitamin C and E, folate, beta-carotene, and lutein. Next, we must pay attention to fiber. A diet higher in fiber and lower in added sugar may slightly increase female infertility. Some examples of high-fiber foods without added sugar include whole grains, fruits, vegetables, and beans. Other than that, we must get active. Exercise has many health benefits, including increased fertility. Increasing moderate physical activity has positive effect on both female and male fertility, especially for those with obesity. Lastly, we must take time to relax. Stress can affect female periods, which may affect females' fertility.
In conclusion, Infertility can often be addressed through the implementation of in-vitro fertilization (IVF). This advanced medical technique can significantly increase a couple's chances of conceiving and having a child. Other ways to enhance fertility include staying active, eating food rich in antioxidants, paying attention to fiber intake, and taking time to relax. As stated in Surah Al-Anbiya, verse 89 until 90, Prophet Zachariah prayed to God for a child despite his wife's infertility, demonstrating faith and perseverance. The verse show that prophets like Zachariah were committed to good deeds and prayed to Allah with hope and fear. They remained humble and devoted. The story teaches faith, patience, and the importance of persistent prayer, even in hopeless situations. Thus, we should not give up and always depend on Allah for our needs.